Is it safe to have PRP after hair transplant surgery, or could it cause the hair to fall out? I had hair transplant surgery 5 months ago, and doctor told me that I should do PRP to improve the hair transplants. My question is it good? After I do PRP, will my hair grow, or will it fall, or no?
Thank you for your question. You've had a hair transplant about 5 months ago, and you were advised by your doctor to do PRP to improve the hair growth, and you're questioning whether or not it will help or will it make the hair fall out. Well, certainly I can definitely share with you a lot of information about this. As a background, I'm a board-certified cosmetic surgeon practicing in Manhattan on Long Island for over 20 years. Hair transplant has been a very big part of my practice, but more recently, in the past several years, platelet-rich plasma, or PRP, has really been a tremendous area of benefit to our patients, not only just for hair, but for other areas in terms of skin, scar, wrinkle treatments, etc. But let's stay focused on the hair. We've actually developed a treatment called hair regeneration. Hair regeneration is actually a combination of platelet-rich plasma with acellular matrix. We've developed this as a standalone treatment for hair thinning. In fact, we've reached a point where we have done so few transplants because people who come to us with thinning hair who want a transplant, we will show them that they can get actually better results by doing hair regeneration. Now, if someone is bald and they want hair in an area that's bald, then transplant is the option. But if hair is thinning, that's a different story. Now, with that understood, there's been a tremendous interest in patients who have had transplant, like yourself, because they understand, especially when they're on the computer and learning more and more, that not all the hair that gets transplanted survives. With FUEs, it's not uncommon for 30% of the hairs not to make it, and that's because of transection, not even because of graft take factors. But then when you take further the number of grafts that actually could potentially heal, you may be down to 50%. In addition, one of the things that helped us make this decision is that when a hair transplant is done in areas where hair is thinning, there is trauma to existing thinning hairs. It's collateral loss. And so patients who get transplants very often don't see as much of a dramatic improvement because the hair that was there, that was thin, gets traumatized by the incisions made to place the grafts, which is why we don't do the transplants as the primary procedure. We actually do the injection as the primary procedure. We've been able to help people who have had transplants, and ideally it's better to come within a month to 3 months, but during this healing phase there may be an opportunity to help the grafts, especially if you have FUEs. And as a side note, it's something that you should be aware of if you had FUE, is that FUE grafts are actually harvested majority of the time when you go beyond a certain number outside of the true permanent donor zone. This is something that people who are doing FUEs understand, but basically rationalize that they have to do it in order to get the numbers of grafts they need. But I see it as borrowing from the future. If you're going to take hairs that are at risk of thinning, then essentially this hair is already temporary. So you may not have that hair in the future. So my position is that hair regeneration can help protect those hairs, as well as existing hairs to thicken those hairs in a combined way. Now, hair regeneration may need to be repeated. We don't know that yet because we have up to about 5 years of data, but the majority and volume and the numbers that we see that are so high is really more within the past 3 years. So that being said, I think that PRP certainly on its own can be helpful, but I think that the hair regeneration method is actually considerably more effective. So it has the PRP, but it has the technology, and we have the data certainly to support it. So you have an opportunity to try to save your existing hair as well as maximize the survivability of the grafts, even though at 5 months there is a big question mark there, because there's a critical period where the graft has to take, otherwise it's not salvageable, and that time frame may already be gone, but you can't be sure, and there may be an opportunity to help you, bottom line, have more hair. So learn about this technology, and I wish you the best of luck. I hope that was helpful. Thank you for your question.